Hi, it's Jessica Namaso with WTF Health. I am here at Frontiers Health, and joining me in the studio right now, I have the man of the moment himself, Roberto Ascione. He is the CEO of Healthware Group and also the chairman of Frontiers Health. So a pleasure to have you here with us.
Thank you for having me.
Of course. We can't have a Frontiers interview without having you.
But you never know.
No, thank you for stopping by. So you've put together, you've helped curate this wonderful conversation, you and your team. And I'm curious, what are the key takeaways for you from Frontiers Health this year?
Yeah, first off, let me say that I'm just contributing as chairman of the conference, but there's a great steering committee that's involved in the conference. As of this year, we have a fantastic lineup of ambassadors. New to this year, their role will be to grow the community in different parts of the world. And I would say the team is really instrumental to the success of the conference. So I would just want to clarify that.
All right, we're shouting out everybody.
It's very important.
Thank you.
It's really a super team. And now we can say, given we are a few minutes from the end of the conference.
We are, and I want to say too, I mean, it's been interesting. It's been such a different mix of personalities on stage this year, and the conversation has been very different. And so I do want to go back to the initial question here and talk about the takeaways.
Sure.
So what are some of the key themes here that have emerged at Frontiers?
I would say, first off, digital health is really happening. It's not longer a matter of if and when and
how,
and big enough. It's happening. Will be big. Is getting bigger and bigger. And I think will be really that transformational, I would say, power that we kind of foreseen years ago. It's really materializing. And I would say this year on year, being the year fourth, really kind of resonates. So that's one thing. I think now the interest is much broader than before. So we not only have the investors, startups, and the innovation functions of the corporations, we have really all the different departments. We have here people from medical, from marketing, from commercial. This, I think, it's an interesting sign, especially in the industry, about how different disciplines are kind of converging because of the transformational power that digital has through these processes.
Okay. And then as far as technology is concerned, I mean, that's been a topic here quite a bit. And, especially how it's enabling different digital therapeutics and then also like different digital health applications. Is there anything that you feel that's kind of emerged in the conversation here at Frontiers Health this year that's been different than previous years as far as the tech is concerned?
I think from a technology perspective, rather than brand new technologies, I think we are starting to observe application of the technology that are meaningful. So even during my keynote, I was pointing out those applications of artificial intelligence that reach clinical validation and are part of solutions ideally aligned with the patient journeys. I think that's really interesting. Everything around the sophistication of the human technology interfaces, it's equally interesting as well. Following the trend that I think it's really powerful of removing the barriers and almost making these interfaces disappear.
We've heard the word frictionless a lot here in the studio.
Yeah.
Lots of that.
It's really important, and I think voice will be quite big. Texting, or kind of chat style kind of interactions are already being piloted. Sight and emotionally conscious agents, robots, if you will be also playing a role. The other thing that I think will be important is anything that passively is able to gather data. We kind of always knew this, but now we start to see real applications of ways to passively gather data. I don't think any one of us wakes up in the morning and wants log data into anything actively and use time for that. So I think everything that will do this for us and will allow to kind of nurture our data-rich profile as users, even before being patients, I think will have a lot to say for the future. So this from a technology perspective. The other thing that I guess it's interesting is that that idea that I'm sort of cultivating over the past years of this much more complex balance between human factors and technology factors. It's really starting to emerge, I guess. So we have been discussing about which kind of new jobs can technology generate in humans. I'm thinking about the health coaches augmented because of the platforms, those that will help us to make sense of the data, maybe on the genetic side, counseling. What if physicians will do most of their activity or a large part of their activity at least remotely? Will they have the same skills, the same structure of work arrangements than, say, physical doctors or predominantly physical doctors? So all these themes, I think, are starting to emerge.
One of the things I've noticed here in the studio, I've had the opportunity to speak with a number of startups here, and most of them, in fact, I think almost all of them, let's say, were European-based. And from 2 years ago to now, I've noticed such a difference in the startup community here in Europe, particularly in digital health. I feel like it's just matured. Have you noticed the same thing? Or
Yeah.
I mean, it's the water is warming around you, but it's like for me, it was such a marked difference this year. How further advanced the startups have become in terms of not only their product, but their understanding of the business model behind healthcare here and abroad. I mean, they're definitely looking to, infiltrate other markets, and it's been pretty impressive.
Yeah. There will be a lot to say about this, but I would say in a nutshell, first off, we are starting to have a more mature European ecosystem.
For sure,
So
even the
clearly,
investment community, yeah.
It started a bit after the US in a way, but it has been catching up. I like to think that Frontiers contributed in a way
I'm
to
sure it
this.
has. I feel like you guys are well known as like the digital health, event in
Yeah.
Europe at this point.
Thank you, and I think to this contributed also the fact that a lot of other partners are really kind of contribute to this platform. But back to the ecosystem, the startups are surely a lot more equipped and mature than only 2-3 years ago. There was also a couple of other factors that contributed to this. I think first off, there's been at least I don't have data supporting this, but some kind of my field observation.
I like that.
I think there's being put more attention on the European markets. Years ago, I was pretty often you were meeting startups that had some early traction in one European country and thinking, okay, we'll go US next because it's a big market, it's easier, which is not easier.
No.
and of course, there's a lot of competition and so on and so forth. Whereas if you look at the domestic markets in Europe one by one, those markets can be quite attractive. Sites-wise, many are very sizable. Think about Germany, France, Italy, UK itself. Yes, they are different markets, but there are some similarities, and there's a certain protection when you get traction in one of these markets from other entrants. So we are observing more and more companies that are doing one country first, and more, I would say, deeply than in the past, and then strategizing what will be the second next country rather than try to, with maybe not so much money, address 10, 15 countries at the same time. So I think that understanding has probably happened, and by applying this more kind of this wiser, expansion strategy is paying a dividend. So that is something that we have seen, and I think it's interesting. And then this doesn't prevent some of them, like you have seen Nuna with Varian, to go through an acquisition that maybe will help them scale, much
Even
faster.
Mm-hmm.
And so other thing that we discussed this year is how these other patterns are materializing. So what's the role of M&A into this?
Right.
What's the role of huge rounds of funding, which is not for this level of startups, but down the line,
Down
why
the
not?
line. Well, sure, you have to think ahead.
So we have been starting to also explore these territories to keep helping the ecosystem to mature.
No, and you can definitely feel it. It definitely feels like it's got a lot more weight than it did a few years, just in a few years. I mean, it's remarkable. So, okay, so, not just the attendees, but you and your team and all of the people that you work with in partnership at, Healthware, and the other businesses that fold underneath Healthware, you come here to get ideas. and you come here to kind of scan the surface and talk to everybody and understand the themes, like you've so beautifully articulated here. So taking all that in and reacting like in real time right here, what's next for you guys? What do you have your eye on moving forward? I'm sure there are plans in flight, but as things are supported by what you're finding out here on site at Frontiers Health, what are you going to do next? What's next?
Yeah, I think there's a nice kind of confirmation of the strategy that we are pursuing.
Good.
This year will be important for us. I mean, the year that is starting in a
couple
few
months
weeks.
here,
Because basically what we have done over the past 3 years has been to reinforce the company and grow the company in all the different disciplines and skills that we thought were needed in order to help the large companies, pharma, medical device, and health insurance company that we work with traditionally to accelerate with their digital transformation, not only from a commercial operations perspective, so the work we do in marketing, the work we do in communication, the work we do in medical education, which is keep going and getting more and more digital, but also helping them to transform part of their revenue models, and so embrace all new revenue streams that can come from digital services added to drugs, or from single, I would say, indication digital therapeutics. Basically completely new revenue streams. What we have been doing over these past years has been to equip ourselves to deal with these two very strong trends. And I feel that we are at a good stage now.
Good.
So what we are going to do next year is to basically be out there as a reliable partner for both of the big companies as well as the small ones, namely startups that already reached some market traction and are looking how they can scale more with a strategy that maybe is a mix of the various tools, whether it's more funding, whether it's strategic partnerships, and we feel we can help quite a bit in creating joint partnership-based business models between pharma, device company, insurers, and startups. So Healthware will continue to expand the digital transformation, marketing, communication service line to the big companies. But at the same time, we will be doing more and more in connecting the dots and creating new opportunities, whether it's new service models, whether it's new business models. So we will be doing more and more about that.
So important to help kind of advance that transformation of healthcare, here and then also abroad. I wanted to ask you about Frontiers Health for next year. So what's the plan? Oh, and in between, I'm stopping over in Salerno again to the Palazzo Innovazione because I had a lovely week there in the summer, and so I'm going to invite myself back, and then I'll invite myself back to Frontiers Health next year. So
absolutely. Talk
a little bit about what's on tap for next year, because I'm sure you've got things sorted out to some degree.
Yeah, I have to say that this year, every year we learn from the past year and the insights that we gather at the event and through the survey that we launch, which by the way will be coming up soon. So it will be important for us, for everyone to provide feedback. I think we reached a certain, I would say, refinement of the structure of the event. What we want to do is really keep kind of fine-tuning the details.
Okay.
So the video lounge, I heard, has been very appreciated.
Oh, well, thank you.
We'll probably, we'll more than likely.
I'm a fan.
I'm sure you are.
I am.
So we'll probably redo this on a even a bigger scale. Looks like the simulcasting of the interviews is really appreciated online.
Good.
So that is
everybody.
something we will be doing. Probably kind of amplified more the announcement about that. And it will be about these little things. I guess this year we had this talk performances where data, music, and lights were involved that were very well appreciated. So I think we will probably keep going on that. What we will be doing though is ask ourselves, should we do this again in Berlin, or should we change city?
Oh.
So what
do you want to give us a scoop here on where else you're thinking? We can take an online vote.
That's what we will end up doing.
Okay, good.
So the survey will contain that question.
All right.
And because we love Berlin, and more than likely we'll be here again. But there are a lot of other, several other cities that are saying, why don't we do there? And on the other hand, we will be having more fast tracks. This year we did San Francisco and Milan.
Yeah.
But with more ambassadors, we hope that other fast tracks, so these kind of small alpha day mini frontiers, will take place in different other countries, and this will also contribute to keep growing the event. So it's a platform that is built collaborative by the community, which is much larger this year. So I just encourage everyone that is interested to just reach out as a corporate partner, as a knowledge partner, as a local ecosystem that wants to connect with the Frontiers Health platform. Feel free to. We'll be more than happy to strategize together for 2019.
Fantastic. Well, we'll let you go close this conference.
I think I have to go.
I think you've got to go. I think you do too. Thank you so much for sitting down and talking with us. It's always a pleasure to hear, what you took away from the event, and as somebody who's organized it, because I'm sure as it unfolds, certain things go the way that you expected, and then other things never go the way that you expected. So it's always a pleasure to hear kind of what your thinking was as things have gone on here on site. Thank you for having me in the video lounge. It's always a pleasure.
Thank you very much.
Thank you.
See you all.
I'm Jessica DeMassa with WTF Health here at Frontier South with Roberto Ascione, who's going to close down the conference now. Thanks so much for joining us.